Good evening and welcome everyone. We'd like to welcome you to tonight's event. Many of you may already know me, but if you don't, I am Kristi Epstein. I am the nurse practitioner on the neuroimmunology team. So welcome. If you're here, you're either living with MS or you're taking care of or living with someone who has MS. And of course, we don't want to exclude our other people who may have conditions such as MOG or NMOSD. So welcome to you as well. Few housekeeping notes for tonight, as you saw on the slides. Your cameras and your microphones are going to remain muted, and the session will be closed captioned and recorded so that you can watch at a later date. Throughout the evening, very important, we want to make sure that you will enter any of your questions into the Q&A box, because we are going to address those at the end of the evening for a Q&A. So we look forward to seeing what questions you might have. And I am going to serve as moderator, and I'm also going to present tonight. So I'm looking forward to sharing some of our colleagues. You'll see their pictures up on the screen right now, and some of them you may be familiar with, and some of them are going to be presenting tonight. So we're happy to discuss MS-related fatigue. Our team is a collaboration of physicians, physical therapists, pharmacists, neuropsychologists, and researchers. And so we welcome you to our collaborative care program. All right, so with that being said, we're going to go ahead and take a look at a couple of poll questions prior to our first presentation. So in just a minute here, the poll questions will pop up. And when you see that happen, what we want you to do is go ahead and enter your answers into the Q&A box. So first question, I have experienced fatigue related to MS at some point in my life. So go ahead and put your answers in. I'm guessing that there's going to be a lot of yeses. Caregivers, please answer. I'm sure you've experienced some fatigue on the side of the people you're caring for or living with. So wow, it looks like the results, 85% of you answer yes. Okay, excellent. So let's move on. It looks like you all handled the poll results and questioning and answer very well. So remember to keep doing that as we go along through our presentation. Okay, so I'm going to be the first presenter tonight, and I am going to talk about diet and exercise and how that relates to fatigue and MS and other conditions. So I'm going to go ahead and share my screen if you will just bear with me for a moment. All right, we're going to get a slideshow going here. Let's get this up here. Bear with me just for a moment here. There we go. Okay, so first of all, let's talk a little bit about what is fatigue, defining fatigue. It seems like a silly thing to maybe have to define, But there are different types of fatigue, and many of our MS patients and patients with other CNS demyelinating diseases, such as NMO and MOG antibody disease, may also experience all combined types of fatigue. So first of all, I'll go over the types just a tad bit. Some of you may experience motor fatigue. And what motor fatigue is kind of a feeling of exertional decline in your ability to exert force. This could be like muscle tiredness after walking or exercising, or it could be heat related. So many of you have experienced heat intolerance as MS patients. If you're out and about and you're trying to do activities and you get overheated, you may lose your ability to utilize your muscles as well. This could also be as a result of compensating for limb weakness. Some of you may have issues like foot drop or limb weakness on one side or poor balance that cause you to have to work a little bit harder to get through your day. These things can all cause the type of fatigue known as motor fatigue. Things that we can do, some minor interventions that you've probably heard about include cooling off, using cooling cloths, vests, assistive devices, or reconditioning, which I know you're going to hear about later. Other interventions can include medications such as APRN, which is useful at increasing signal speed and therefore gait speed. So another type of fatigue that we need to discuss is specific to MS, and it's called lassitude. I know many of you have experienced this. Lassitude is a very overwhelming fatigue. It can be due in part to the inflammatory side of the disease, which includes inflammatory cytokines. This can be independent of your level of disability. You could have no outwardly visible disability and still experience lassitude. Lassitude is difficult for our patients because it's something that you may be feeling on the inside and not have an outward projection or reason that some people might understand why you're feeling this overwhelming fatigue. Some things that we can do to address lassitude include diet, exercise, supplements, and always good sleep. The other type of fatigue that many of us experience, including those of us who don't have chronic disease, is constitutional or secondary fatigue. There are many factors that can relate to constitutional fatigue, and those include comorbid illness, depression, poor sleep, sleep disorders such as sleep apnea, poorly controlled comorbidities like diabetes, or symptoms such as spasticity or urinary dysfunction that has you getting up during the middle of the night to go to the bathroom and therefore interrupting your sleep. So as you can see, there are many types of fatigue, and these types of fatigue can stack upon one another. So patients could be experiencing multiple types of fatigue that are compounding the overwhelming fatigue that they're feeling. Things that we can do, again, for secondary or constitutional fatigue is exercise, sleep, diet, supplements, and we do always have some medications, and those might include amantadine and modafinil. And I know Dr. Hansen is going to address some of these later on this evening. Okay, so as you might imagine, there is a heavy impact on quality of life with fatigue. The first thing that I want to say to you is your fatigue is real, and it can often be misunderstood by friends, family, and coworkers. In fact, fatigue is one of the leading causes of vocational disability. And that means missing time from work, losing the ability to do the job that you could once do, or in fact, possibly losing your job. It has a complicated relationship to mood disorders like depression. So it can impact your quality of life as it relates to your mood. It could make your depression worse. It could affect your interpersonal relationships. And sometimes your fatigue can be caused by the medications that you need to take to address symptoms related to your disease process. And sometimes those medications are necessary, but they can contribute to fatigue. The National MS Society, one of our great partners to collect data, reports that up to 80% of MS patients experience one or more type of fatigue. So what can we do about it? I know that you hear a lot of talk about supplements, diet, exercise, and I'm here to tell you that these are all things that can help and are modifiable by you, which means on the medical side, we can give you the best disease modifying therapy, the best medical intervention that's possible to address the immune side of your disease, but there are modifiable things on your end that you can do to help with MS-related fatigue. So when we look at supplements and diets, what we're going after and what many of the popular diets are trying to incorporate is the idea of mitochondrial support. If you have not heard of that before, I'll just briefly go over that. And what that means is helping our cells function the best way that they possibly can. Mitochondria are little power stations in our cells that convert nutrients into energy. And mitochondrial dysfunction is commonly seen in many chronic diseases, and it is most definitely directly related to excess fatigue. So by doing exercise and diet, we can use this as an adjunct to your standard disease modifying therapies to improve fatigue. So some recommendations include limiting processed foods, limiting added sugar and sodium, and limiting saturated fats. Some examples of types of diet that I'm sure you've all heard of might include an anti-inflammatory diet, Mediterranean. There are patients who follow specific diets such as Wall's protocol or the Swank diet. At Ohio State University, we do not recommend any particular diet, but what we do say is that any diet that works for you, that you're not allergic to, doesn't cost incredible amounts of money for you to get involved in, and is backed by science, is okay if you check it with your provider. Another thing that we'll talk about a little bit beyond this healthy diet that we promote is the concept of intermittent fasting. And many of you who've already seen me in the Quality of Life Clinic have talked to me about this. And we'll get into that a little bit more in depth. But intermittent fasting is a tool that we can use to improve fatigue. So some of the supplements that I've listed here are supplements that help our cells and provide mitochondrial support. So L-carnitine, B12, coenzyme Q10, vitamin C, alpha lipoic acid, riboflavin, and vitamin D. Of course, you know, all of our MS patients need to take vitamin D because it has a very important role in downregulating inflammation in the central nervous system. All of the other supplements here that we mentioned can be found in a healthy diet. So it's not always necessary for you to go out and spend money to buy supplements. So other things that we can do beyond healthy diet and supplements is we can make behavioral changes. These we should do in combination with healthy eating, exercise, and good sleep. So what are those? One of the things that it's going to be talked about a little bit later on this evening is energy conservation. A lot of patients are probably already doing this, but may not know what it's called. And that means if you know that you have a certain amount of energy in your tank and you have an event or something that you want to do later on, you may rest earlier in the day in order to save energy for the activity that you're going to do later on. Exercise. We all know that the more you exercise, the better you're able to exercise, the better able to rest, and the less fatigue you're going to feel. With exercise, it's most important to start low and go slow. So you just want to start with a small amount of exercise and gradually move up to what you're capable of doing. Circadian rhythm adherence. We have a wonderful sleep specialist who's going to discuss that this evening, but it's really important to maintain a good sleep and wake cycle. So going to bed at the same time every night and waking up at the same time every morning. Some of the exercises that we recommend include yoga, which is whole body stretching and wellness, Aquatherapy is wonderful, and we provide that here at The Ohio State University. We recommend mindfulness. So any type of meditation or mindfulness practice is good for overall fatigue. Other things that are helpful, getting a Fitbit or any type of tracker to kind of track your sleep-wake cycles and your exercise. Counseling and talk therapy is helpful to work through things that may be contributing to your fatigue, such as mood disorders. And of course, at The Ohio State University, we do offer cognitive behavioral therapy to help you work through your fatigue and coping with chronic illness. So intermittent fasting. This is a great topic, and it's recently gotten a lot of buzz at some of our well-known research entities. ACTRIMS, for example, there was a great paper that was presented about weight, obesity, and adipokines by Dr. Laura Pico. And they sort of determined that intermittent fasting had really good results in mouse trials in reducing the severity of disease. So there are many types of intermittent fasting that you can do. I just put a few types here, but the easiest thing to do is just 12 hours on and 12 hours off. So that means 8 a.m. to 8 p.m., those are your eating hours. 8 p.m. to 8 a.m., you're not eating. And after that time, once you get comfortable with that, you can move on and try different types of intermittent fasting. These are things that we can discover and talk about in depth if you'd like to come and have a visit in the Quality of Life Clinic. If you have any questions, please, of course, just let me know. So some of the famous diets that you know about, one called the Walls Protocol and the other called the Swank Diet, they decided to do a randomized controlled trial and see what results they would get with patients who adhered to this type of diet. And the diet was mainly focusing on mitochondrial support. And so what they found, their finding was significant for quality of life. I'm just going to read out a few things that came out of that study. And this is the WAVES trial, if anyone is interested. And Dr. Terry Wall at the University of Iowa, who has her own special diet, was involved in this study. And what they found is fatigue, as we already mentioned, is one of the most common and debilitating symptoms reported in MS, and it's associated with increased disability and reduced quality of life. So pharmacologic treatments have limited efficacy. So many individuals are out there seeking non-pharmacologic therapies to reduce fatigue burden. So despite a lack of evidence for consistent specific diets, as I mentioned, surveys observe that half of the individuals with MS report implementing some type of dietary modification. And in fact, many patients find that they are trying to get input from neurologists and dietary recommendations very often when they're newly diagnosed with MS. So the findings from this trial did confirm those of preliminary trials, and it showed that this type of diet and adherence to healthy diet was associated with a significant reduction in fatigue and improvements in quality of life amongst relapsing remitting participants. Again, all of these diets are doing is extracting all of those supplements that we looked at from the diet in order to increase mitochondrial support. So in order to achieve quality of life, we have to work together. It takes a team, and all of the professionals that you see here, our neuropsychologists, our clinical pharmacists, your primary care physician, your primary lead physician in the neuroimmunology team. And we welcome you, and we're so glad that you're here to discuss MS and fatigue, and we're going to move to our next presenter. Okay, it is my pleasure to introduce Dr. Stephanie Kelp, and I'd like to welcome her. She is a neuropsychologist, and she is a graduate of Northwestern University, Feinberg School of Medicine, and she completed her fellowship here at The Ohio State University Wexner Medical Center. She is a clinician, and she works with her patients to better understand and maximize cognitive, emotional, and functional quality of life. Welcome, Dr. Kelp.
Hi, everyone. I'm happy to be here and speaking about some of the cognitive rehabilitation strategies that can be used to address some of the fatigue that can be experienced in MS. Since I'm a relatively new addition to the MS team here, I thought I'd start by talking about what it is exactly that I do as a neuropsychologist. So by training, I'm a clinical psychologist who has specialized expertise in neuroanatomy and the neurosciences. So I'm really interested in looking at the relationship between our brain and behavior. A big part of what I do is neuropsychological assessments, which involves paper and pencil testing that can be used to identify cognitive strengths and weaknesses, and then assist in treatment planning. Another part of what I do, though, is talk therapy. So evidence-based cognitive behavioral psychotherapy or cognitive rehabilitation, where the goal is really to maximize an individual's brain health and overall functional quality of life. In MS, we know that quality of life can be impacted by a number of different factors. And these factors are often closely related to each other. So it's not hard to imagine that if we're dealing with significant pain, for example, that might increase our stress level, which would negatively affect our mental health. And when our mood is not great, it tends to affect our sleep. And when we're not sleeping, we're much more vulnerable to experiencing things like fatigue and cognitive symptoms. And then when we're living with these symptoms, it kind of increases our stress level, which maybe then makes it harder for us to be our best in our family and social relationships, which then can further affect our mental health. And, I could go on and on, but the point here is that all these factors are really closely connected. And if this image was actually a little bit more accurate, we'd have these lines kind of connecting all of these different bubbles. And one, I guess, silver lining when factors are so closely interrelated like this is that oftentimes I find that if we can just address one of these things, the others will sort of fall in line and can improve those as well. And of course, my talk this evening will be on steps to address the fatigue and cognitive symptoms that we can see in MS. So these are often referred to as the invisible symptoms of MS because, of course, they're not always as evident to individuals in the world as, some of the motor or physical symptoms, but they're really common and can be just as debilitating for folks. So fatigue, for example, is experienced by, excuse me, almost everyone who has MS, and about half, if not more, folks also report significant cognitive concerns, and this can look a number of different ways. So some individuals struggle with attention and concentration. Others report more day-to-day forgetfulness and short-term memory loss. Others just describe this sort of mental inefficiency or brain fog, what I call cognitive fatigue. And when I was looking for images to make my talk a little bit more colorful, I Googled fatigue. One of the images that kept popping up was this here of a low battery. And I think that really is a good metaphor for the cognitive fatigue that we see in MS. We have so many of these stressors that can just really take the gas out of our tank and leave us feeling like mentally we're just running on empty. And so fortunately, we do have some behavioral health treatments that can be used to address cognitive fatigue in MS. This really involves what's called cognitive rehabilitation, which is talk therapy that's aimed at improving functional quality of life through implementing compensatory strategies that people can sort of implement in their day-to-day life. And so I'll typically see folks for an initial session where I'll get a sense of their concerns, their needs, their overall goals. And then the next few sessions we'll spend kind of brainstorming and thinking about strategies that might be helpful for them. And then between sessions, I always give folks homework so that they can be practicing strategies outside of session. And then we're constantly sort of reviewing and problem solving and making adjustments so that we're really kind of maximizing day-to-day living as much as possible. One thing I've found that can be particularly helpful for addressing cognitive fatigue is this idea of activity pacing. So oftentimes individuals who experience cognitive fatigue find that they have this tendency to really push themselves to get a lot done on days when those few and far between times when they may be having a good day, which makes a lot of sense because if you're feeling well, you want to take advantage of that and do as much as you can. But a lot of times what happens is this pattern sort of develops where we will do overactivity, which then can really increase our fatigue and then sort of take us out of commission for like several days where we're needing to really rest and spend a lot of time kind of refilling that, recharging our battery. And so we get in this pattern of overactivity, fatigue, and then, maybe days of rest. So a lot of times I work with individuals to be a bit more strategic about how they're planning their activities, being a little bit more mindful about how they're utilizing their limited brain resources so that they're able to kind of have a more balanced cycle between activity and rest. So they're kind of expending energy, resting and recharging, getting things done, and then recharging their battery in a way that's a little bit more sustainable. So they're not kind of being taken out of commission for days at a time, but rather having a more balanced cycle between this rest and activity. And then I also use a lot of other compensatory strategies. These are just a few that can be useful for brain fog, but also some of the more specific cognitive concerns that we can see in MS. For example, folks who struggle with day-to-day forgetfulness can really benefit from simply finding a single location, designating a single home where they keep frequently misplaced items like, keys, wallets, cell phone. A lot of times I work with individuals to set up regular alarms and systems to manage important things like their medications. I help people get a day planner or that they can use to keep track of important information, appointments, things like that. For folks who struggle more on the concentration and attention end, it can be super helpful to get in the habit of taking large projects and breaking them up into their smaller component parts. And then scheduling in frequent but brief breaks throughout their workday to sort of maximize their productivity while implementing strategic rest that can be used to sort of recharge their battery as they're working. It can be also helpful to develop the habit of finishing one task, before starting another, and just simply structuring their workplace or environment in a way that minimizes potential distractions. And so those are just a few of the examples of cognitive compensatory strategies and cognitive rehabilitation and interventions that can be helpful for managing cognitive fatigue in MS. I'm happy to speak more about those and share more of these strategies, but these are just a few resources that can be helpful in kind of understanding and living with MS. So thank you so much. Bye-bye.
What a wonderful presentation, and I'm sure there'll be lots of questions for you. So we're going to move on, and it's my pleasure now to introduce Dr. Kara Gillum. She is a doctor of physical therapy here at The Ohio State University, and she is an OSU grad, so of course we love her. She practices at OSU's Powell location and treats patients with a variety of neurologic diagnoses, including multiple sclerosis, Parkinson's, vestibular conditions, spinal cord brain injuries, and post-COVID syndrome. She's currently pursuing her neurologic specialty certification, so good luck to you with that. Dr. Gillum, we're so glad to have you join us this evening, and we look forward to your presentation.
Thank you for that great introduction. I'm going to share my presentation here with all of you. There we go. So as mentioned earlier, I'm going to talk a little bit about different energy conservation strategies. Some of these things will overlap with other presentations in terms of just talking about the importance of exercise and pacing yourself. But I'm going to try to give you a few principles to help guide you So you can save up some energy in your tank throughout the day so you can accomplish everything that you want to get done. So we'll talk about the effects of MS on your energy levels, some of those energy conservation strategies, ways to keep an eye on your fatigue so you know when you need a break, and giving yourself time for recovery and how to use a little bit of exercise to help improve your energy throughout the day. As we talked about, fatigue is the most common symptom for patients with MS to report. It's very, very common. And it generally occurs on a daily basis and impacts daily activities. So that's why it is a really important thing to address. Often it's more severe than normal fatigue. So that's why it can be really challenging to deal with. And as mentioned earlier, it can be aggravated by heat or humidity. But also things like stressors, or if you're in a really busy environment and trying to focus on one thing, it can be a lot to handle. So something I just want to talk about a little bit is, does something make you more mentally tired or more physically tired? There is a difference, and sometimes it's hard to differentiate which way you feel throughout the day just because you're always using your brain whenever you're doing things. But if you think about activities such as planning your meals or grocery list, reading, talking to family or friends, trying to make plans, driving or paying bills, those things usually are more cognitively fatiguing, while cooking, cleaning, driving, moving around, bathing or dressing, and getting from one place to another can be really physically exhausting. So I just want you guys to try to think of a few things in your life that kind of fit in one of those categories, or if it's something that makes you tired in both of those ways. Some ways to manage your day and try to help out with improving some of your energy conservation can be to prioritize. Try to think of those things that you have to get done during each day, if you can, when you start off or the night before, and think of the things you have to get done, the things you would like to get accomplished, but don't have to be, and then the things that you'd love to get taken care of, but could always get done another day. And really try to start with those things that are most important to accomplish. So that way you aren't tiring yourself out trying to get those things done that maybe aren't as important to complete today. Also allow for rest time between those different activities. And this can be something called active rest. I like to use this a lot in my sessions, where it's not that you're necessarily not doing anything, but you might be doing one of those things that make you more mentally tired, or trying to do some relaxation or some physical activity, but that can be a break from those things that you have to accomplish throughout your day and can allow you some time to recharge a little bit. Planning, try to alternate some of those activities that make you more mentally or physically tired, so that way you aren't just pushing through one thing and another, just trying to mark as many things off your list, but then you're just really, really tired and you say, okay, well, I still need to run some errands, or I have PT today or an exercise class or something, and I don't really have the energy to do that anymore. And the last thing is try to consider the environment that you're in. So if it's hot outside, like in the summer, try to plan so that way, maybe if you enjoy doing aquatic exercise, or if you can have more fans available in a room, or try to turn down the thermostat a little bit, or make sure you have plenty of water in any situation that you're in, to try to minimize those factors that are going to increase your fatigue exponentially. But also it could be things like stress, or like I mentioned earlier, if there's things around you that tend to distract your attention a lot, or can be really hard to make it focus on something that you're doing, that always takes more energy to kind of filter out everything around you than it would if you're in a more quiet environment. Some other strategies, you can sit while you're performing some activities such as folding laundry, cooking, or if you're trying to make a list and trying to plan out your day like we've talked about, you can always sit when you're doing that if you're able to. Use an assistive device. This can be anything from a trekking pole or a walking stick to a walker, rollator, electric wheelchair. All of those things are made to help you stay safe, improve your balance, and the efficiency of your walking. So if you've been prescribed any of those things, or it's been recommended, then those can be really helpful for making you more efficient getting from place to place. Also things like grabbers for dressing, and there's a lot of adaptive equipment available. If you've ever worked with an occupational therapist or a physical therapist before, there's lots of different tools that can make daily tasks a lot easier and quicker. Also set up your home, your office, so that way you do have some chairs or spaces where you can take a rest break if you need to throughout the day, because that fatigue can hit pretty quickly. So if you have plenty of places where you could stop and take a break, that makes it a lot easier to do that. And then trying to minimize trips if you are trying to gather some things together or prepare for your day. Make it so that you hopefully don't have to make as many trips back and forth as much as you can. But most of all, I always tell my patients, take as much time as you need to stay safe. If you are rushing more often, it's going to tire you out quicker, and you're more likely to do something that's not quite as safe or lose your balance. So it's always more important to take your time, because usually you'll get there faster than if you rush and you were to lose your balance or something. Also, monitoring your fatigue can be really important. Sometimes we don't realize how tired a specific activity can make us, or it just changes depending on the day. So if you think about this 0 to 10 scale, I'm sure that you guys have rated your pain on a scale similar to this if you've stopped and seen the doctor lately. But if you think of 0 as no fatigue, I'm not tired at all, and 10 is the most exhausting feeling you've ever had, and you just have to go rest right now. Try to rate different activities and how you feel today based on that. So, and like I said, this can change. So if you're feeling more tired with something, that's when you might need to say, okay, maybe I need to take a few things off my list that I was going to do today, so that way I can do something later. Keep an eye on this scale just as you're moving throughout the day, so that way you know and take breaks before you hit that point where you're just so exhausted you can't really do anything else. So this scale is a good tool to have kind of in the back of your mind throughout the day. Also, I think we have 2 poll questions that we'll go ahead and go through. So you guys should see those pop up on the screen from a few of these things that I've been talking about, if you want to take a minute to answer them. So the first question is, if you feel tired later in the afternoon, no matter how rested you feel before this time, and it happens every day, what is a good modification you might be able to use to help you still complete your daily activities? Would you want to avoid anything before that point? Plan an exercise right at 3 o'clock when you know you're going to get tired? Work on something like that you can do in sitting, or none of those things? Any of those seem like good ideas? Okay, yeah, you guys did pretty well. Nice job. So I chose C as the right answer. Sometimes if you know that exercise can help you, then doing some like moderate activity can be helpful. Sometimes that helps them bounce back. And if you know that you're absolutely exhausted, then you might need to avoid some things. But overall, I would try to do some of those active rest type things. So you can try to do some things sitting down and see if that helps you rest enough to be able to do what you need to the rest of the day. And then we'll go ahead to one more question. If you're going to walk out to the mailbox, you're feeling your fatigue's about a 3 out of 10. But after the activity, it goes all the way up to an 8, which is pretty severe. What are some modifications you might be able to use next time to make that a little bit easier for you? Nice job, guys. I'll say you're all right no matter what, because they're all appropriate. So it just depends on the person, whether standing and taking a break, sitting, using an assistive device, all of those things would be good strategies, just depending on how what's most appropriate for you. So nice job, guys. One more slide here. Again, as I talked about, exercise can be really helpful for improving fatigue, gradually increasing it over time to help with your endurance. This might look like a more seated exercise or laying down versus standing, just depending how tired you are and what your activity and mobility level is. But also aquatic exercise can be a really helpful way to get a lot of exercise without being as exhausted from moving around on land. And then again, if you aren't sure how to progress your activity or you haven't seen physical therapy before, it can be really helpful for trying to give you that appropriate dosage of exercise. If you're having more trouble with communication or functionally using cognition or memory to plan your day. Speech therapy can be really helpful. And then occupational therapy can help more of those activities that like bathing, dressing, cleaning, taking care of yourself, or helping with stuff that you might need to do at work to build strength, like in your arms or hands, with other energy conservation strategies. So always keep those in the back of your mind. And thank you so much.
Thank you so much, Dr. Gillum. That was an amazing presentation. And thanks for breaking it down for us on the different types of therapy. And as you all know, we do have aqua therapy here within our physical therapy department. And if you're not aware of that, please talk to your provider or your local friendly nurse practitioner, and we can get you hooked up with that. So next, it is going to be my distinct pleasure to introduce Dr. Meena Khan. She is our sleep specialist, and she is the lead provider in the MS Sleep Clinic. She's an associate professor of clinical medicine at The Ohio State University Wexner Medical Center, and she completed her medical school as well as neurology resident and sleep medicine fellowship here at The Ohio State University. Currently, she's the program director of the Sleep Medicine Fellowship Program and co-director of the annual OSU Sleep Symposium. So welcome, Dr. Khan. We look forward to your presentation.
Thank you for that introduction. So I'm going to talk to you guys about sleep and some sleep tips that will help you sleep better. We'll start out with a poll though. The poll will come up here in a second. So how often do you feel you struggle to fall asleep or stay asleep? Not often, a few times a month, a few times a week, or almost every night? All right. So it looks like most people do struggle with sleep. So hopefully this will be helpful. This talk will be helpful to you guys about some things you can do to try to help yourself with sleep. So during this talk, we'll talk about how our brains sleep, and then what can you do to try to obtain good sleep. So how we sleep depends on two forces or two models. So one is what we call a circadian drive, which basically we all have a sleep clock in our brain. It's in a part of our brain called the hypothalamus. And this has natural times when we're sleepy and when we feel more alert. And then there's also a sleep drive or a sleep need. So the circadian clock, or the biological clock, basically has a natural time where your alertness increases at some point in the morning. Typically there's a dip in your alertness. Usually it's after lunchtime. And then there'll be an increase in alertness or a second wind. And then sometime at night, this alertness level drops off. So you may notice in your own life, there's certain times that you feel sleepy. There's a wall that you hit a certain time every day. There's a certain time, maybe at night, that you tend to get sleepy, or a certain time in the morning that you tend to wake up no matter what you do. And part of that is related to this biological sleep clock. So this sleep clock can be altered. The biggest way to influence your sleep clock is with light, sunlight being the strongest light. So when we want to be awake, we should expose ourselves to sunlight. And when we want to be sleepy, we should make sure that it's dark. Other things that can affect your sleep clock are your eating, your activities, your social cues. So it's nice to have some sort of structure to your day. Even if you feel very debilitated by your illness or by other things going on, having some structure to your day is going to help set your circadian clock to the sleep-wake cycle that you want. If you don't really have any activities planned for the day and you kind of sleep-wake whenever you want to, you really won't be able to get on a good schedule. The other thing that determines when we feel sleepy is something called a sleep drive. So as soon as we wake up, we start building the need for sleep. We actually build up a chemical called adenosine. And the higher this chemical is, the stronger the need for sleep. Things that can blunt this adenosine level are things like napping or getting up later or having variable wake times. Caffeine actually works to promote wakefulness by blocking the effects of adenosine. So it's an adenosine receptor blocker. And so that's how caffeine can help us feel more awake. And then when we sleep, whether that's our sleep at night or whether it's a nap during the day, the adenosine level will come down. And so when we sleep, this adenosine level is going to fall off, and then we wake up, it's going to rise back up again. So the ideal time to sleep is when we match our dip in our circadian alertness to the maximum sleep drive. And wherever these overlap is the ideal time to sleep. But if people are kind of sleeping when they don't feel that tired, or they're blunting their sleep drive and maybe getting up late or taking a nap, sometimes these two processes get out of sync, and then people can develop sleep problems. So what can we do to obtain good sleep? So one of the biggest things we can do is to try to set our circadian clock to the sleep-wake cycle that we want to have. So when you wake up in the morning, expose yourself to bright light. Sunlight is the best light. The kind of dim light in the rooms and the lamps isn't really bright enough to really entrain our circadian clock or our sleep clock to when we want to be awake. So sunlight is the best. So open up the shades, expose yourself to sunlight. If you're getting up at a time where the sun isn't out, you can get a bright light box. So if you get a bright light box, it has 10,000 lux of light, and expose yourself to that in the morning for about half an hour. That can be the jolts that your brain needs to be like, hey, this is the time to be awake. And at the same time, when you're trying to sleep, it should be dark. And the bigger the difference between the bright light when you're awake and how dark it is when you're trying to sleep, the bigger that difference, the stronger the signal is going to be to your sleep clock of when you want to be awake and when you want to be asleep. So if you're in dim light all day and it's a little bit darker when you go to sleep, your brain's not really getting that strong signal and may not get into a good sleep-wake pattern. The other thing is to build your sleep drive. One of the best ways to do that is get out of bed the same time every morning, or relatively the same time. So we'd say try not to vary your wake time in the morning more by half an hour to an hour. That way you're building your sleep drive at a consistent time. And also your brain is kind of getting the cue that this is the time I want to be awake and start your day. The more routinized you are with your sleep pattern, the faster your brain is going to get the signal of when you want to be awake and when you want to be asleep. So our brains work very well with routine. Avoid prolonged rest during the day. So if you need to take a rest, that's fine. If you need to take a little bit of a break, that's okay. Just try to keep it maybe 20 to 30 minutes if you can, 1, 2, maybe even 3 times a day. But just keep them brief as opposed to laying down for 2 to 3 hours at one time. And then if you can schedule it, that might be even better. So you have your nighttime sleep from this time to this time, you get up, you take a rest at maybe 10 a.m., another one at 2 p.m., and just try to keep it routinized. Again, the more routine things are, the times start to become a signal to your brain of when to expect things, and then your sleep can become more regulated. And then during the day, again, engage in activities as you're able to. Again, this really helps your brain get into a routine for sleep and waking activity, which can help you just feel better and function better overall. Other things to train your brain for sleep is, your bed is for sleep only. So, we say the bed should be for sleep and intimacy, and everything should be done somewhere else. The reason is you want your brain to think of your bed as sleep and not wakefulness or other things. So things that can deter from that relationship is if you are using your phone in the bed, reading in bed, watching TV in bed, doing work, doing homework, what have you in bed, then your brain doesn't have that association. So I always tell my patients, if you're hungry, usually you go to your kitchen and look for food. You don't go to your bathroom to look for a snack. That's because your food tends to be in the kitchen and your brain knows that whether we think of it that way or not. So the more routinized that is, the more your brain's going to get the idea your bed is for sleep. Just go to bed when you're sleepy. So if you lay in bed for a long time awake, that gets frustrating for you to not be able to sleep. And then your brain doesn't have that strong association between bed and sleep either. So if you can't sleep, it's probably better, and you feel like you have to read or do something, then it's better to get out of the bedroom, ideally, at least out of the bed, but ideally out of the bedroom, and do that somewhere else so that you reserve your bed for sleep only. The other thing is don't sleep in multiple areas. So don't go to your bed, then go sleep on the couch, then go sleep on the guest room. Again, then your brain doesn't really get that strong association between your bed and sleep. And it can impair your ability to sleep well. And again, same wake time every morning is important. One, to start your circadian drive, and the other is to get your brain into that routine. Other things that can help you sleep, caffeine can really be a big deterrent for sleep. And I think sometimes we underestimate how much caffeine can affect us. So in young, healthy 20-year-old, it's been shown that caffeine can last 10 to 12 hours in your system. And this probably just gets longer as we get older. And if our metabolism is different, it probably gets longer. So in general, we would say to avoid caffeine 10 to 12 hours before you're going to go to bed. Exercise can help sleep, whatever you're able to do, any time of the day that you're able to do it, that is going to help with your sleep drive at night. And then if you're having trouble sleeping, avoid distractors from sleep during your bedtime. For example, if you're having trouble sleeping, this isn't the time to get on the phone and catch up on your social media and catch up on your work or catch up on your emails, because those are engaging to your brain. So anything electronic is going to be engaging to your brain. Anything you're interested in is going to be engaging to your brain. And so if you're having trouble sleeping, catching up on these things or watching a show you're interested in is not going to make you feel sleepy. It's just going to make your brain feel more keyed up. If you feel like you need to do something because you're laying there and it's frustrating, then again, get out of the bed or the bedroom. And we usually recommend things like reading something boring you're not interested in on paper, avoid electronics, listen to a boring podcast, but something that's mundane, boring, uninteresting. Think of your, a teacher you had or a subject you had that just puts you to sleep. That's what you want to be doing in the middle of the night if you can't sleep, not something you're engaged in. And then consistent times in and out of bed. Those times then will start to be a cue to your brain. This is bedtime, this is wake time. The more consistent you are, the faster your brain's going to get that signal. I'll just talk on this one slide about sleep medications. There are so many sleep medications out there, and probably another 10-minute talk just about medications. But what I will say is medications don't affect your sleep drive and they don't affect your sleep clock. So they can have a role, if you feel very restless or stressed out and you just have trouble turning your brain off and you're doing all of these behavioral things and you still are struggling to sleep. A sleep medication may help kind of take the edge off and help you get to sleep. But if you're not doing any behavioral strategies to help get your sleep on track, a medicine typically will not work, or if it works, it's temporary. So what we would suggest is get your sleep behaviors in line to get your sleep drive up and get your circadian clock to where you want it to be. And then typically would say take the medicine half hour or so before you get into bed, so you're able to help tip yourself over to sleep. If you take your medicine early when your sleep drive isn't high or your alertness level isn't low, then more than likely it's not going to work, or it's not going to work very well. So again, medicines can have a role, but you want it to be additive to behaviors to promote sleep and not the only thing that you're doing for sleep. And then lastly, I'm happy to see you in the clinic and go over all of these things with you, but there's also a lot of resources for you that you could reach to help you with behavioral modifications for your sleep. So there's a free app called CBTI Coach that you can get if you have a smartphone, like an Android or an iPhone. Also, there is this website here. It's Path to Better Sleep. It's through the VA system. And both of these can give you guided behavioral changes that you can do. So they teach you about sleep. They go into more detail about some of these behavioral strategies that I talked to you about briefly here. And they can design a program for you to help you achieve better sleep with behavioral changes. And thank you.
Thank you so much, Dr. Khan. What a wonderful presentation. I got distracted because I was taking down notes for myself. So I know everyone enjoyed that talk. And again, let me reiterate that you can see Dr. Khan in our MS Sleep Clinic, in our multidisciplinary clinic, and you can be referred to her through your primary provider or nurse practitioner, or you can request to see her via my chart. So hopefully you'll get the opportunity to meet with her if you need to do so. And next, it's going to be my pleasure to introduce a very important member of our team, Dr. Hansen. She is our clinical pharmacist, and she is responsible for so much in our department. Many of you may have met her as a disease-modifying therapy educator. She does a lot of other things. She monitors labs, and she makes sure to check vaccination status for our patients. And she does a lot of work behind the scenes with enrollment for very expensive MS drugs, prior authorization, and making sure that we can get the drug to you. So it's my pleasure to introduce Dr. Hansen, who's going to discuss medications and MS fatigue. Dr. Hansen?
Thank you for that introduction, Kristi. We were having a little technical difficulty earlier, so I don't have my video on today, but hopefully you can all hear me just fine. And then if my slides are ready. We can go ahead and get started. Okay, excuse me. So today I'll be presenting on, are your medications causing MS-related fatigue? So we'll look at possible medications that could be contributing to fatigue, and also take a look at some of the medications we have available to treat MS-related fatigue. Next. So by this point in the evening, we're all very well aware of why we're focusing tonight on fatigue and why it's such a very important topic for our patients. It has a huge impact on quality of life, and we've heard great presentations so far on kind of the different approaches to treat MS-related fatigue. Next. So MS-related fatigue is complex. While multiple sclerosis may be the primary reason that someone is experiencing fatigue, other secondary causes should be identified, treated, or minimized to avoid further worsening of fatigue. Next. These other factors may include things like sleep disorders. Next. Other health conditions like thyroid disorder, anemia, or even MS symptoms that could affect your quality of sleep. Next. Mood disorders, especially depression, can affect fatigue. Next, and of course, medications, which is where I come in. I think we'll let the slides catch up a little. Great. Next. So on this slide and the next, I've listed medications that may commonly be prescribed to people with multiple sclerosis and could worsen the fatigue that someone may be experiencing. These include pain medications like opioids, but also many of the medications that we may be using to treat nerve pain that can be common with multiple sclerosis. These can include gabapentin, Lyrica, and some of our older antidepressants like amitriptyline and nortriptyline. Most of our muscle relaxers can cause some drowsiness and sedation as well, and benzodiazepines are known to cause significant CNS depression. These are commonly Xanax, Valium, Klonopin, and Ativan. Next. Not surprisingly, our sleep medications can also worsen fatigue. People may experience a hangover effect, meaning that they're still experiencing some of those sedating effects of the medications when they wake up. Like benzodiazepines, these medications aren't really intended for long-term or frequent use, and so their use should be limited to the lowest effective dose for the shortest amount of time. Many of our anti-seizure medications can also cause drowsiness, fatigue, especially when starting or changing a dose. For our MS population, often these are used for treating nerve pain or possibly to prevent migraine. Most of these medications mentioned so far may worsen fatigue due to causing drowsiness, sedation, or CNS depression. And these effects can be additive. So being on multiple medications can have an additive or a piling on effect that can affect fatigue. This isn't an exhaustive list, but ones that we most commonly see in our MS population. It is also important just to mention that in addition to causing drowsiness, some of these medications could disrupt the quality of your sleep. So medications like diuretics or water pills that are used to treat high blood pressure might cause someone to use the bathroom more frequently. And if you're getting up multiple times in the night, that might affect your quality of sleep. Next. So what should you do if you think your medications may be making your fatigue worse? Next. Do talk to your doctor or pharmacist about which medications could be making your fatigue worse, and do consider with your doctor decreasing doses or trialing stopping some of these medications if you're not sure if they're beneficial. Do limit the use of benzodiazepines and sleep medications to the shortest duration possible. And possibly most importantly, do continue taking your MS disease-modifying medications. Having a relapse MS activity can be associated with a huge increase in MS-related fatigue. Next, what you shouldn't do is stop your medications without talking to your doctor first. And finally, the list of medications that I provided that could worsen fatigue is not meant to scare you away from using them. Instead, careful consideration should be given to if a medication is truly beneficial and what other effects it could be having on your MS symptoms. Limiting the number of medications that can worsen fatigue can provide a balance between not worsening fatigue and treating your other MS symptoms with the ultimate goal of giving you the best quality of life. Next. So next, let's look at what medications we do have to treat MS-related fatigue. Currently, there are no FDA-approved medications specifically for the treatment of MS-related fatigue, but there are a few medications that have been studied and have off-label use for this purpose. These include amantadine, modafinil, and sometimes the amphetamine-like stimulants like methylphenidate or Adderall. Next. We won't go into specifics of these medications in much detail for the sake of time, but amantadine is dosed twice a day, and most common side effects can be dizziness or maybe some low blood pressure, especially when starting the medication. Effects of most of these medications can be seen pretty quickly, so within a couple of weeks, you should have some idea if they may be beneficial for you. And so if they are, they can be great to continue, but if they're not, they are medications that you can consider discontinuing. Next. Our next medication is modafinil. Again, this one can be dosed once or twice a day, and most common side effects are headache and insomnia because these medications do work to promote wakefulness and can be stimulating. Important drug interaction with modafinil is that it may decrease the effectiveness of hormonal birth control. So it is recommended to use a backup method if you're using hormonal birth control that includes the pills, shot, implant, or ring. It does not affect IUD effectiveness. Next. Finally, we have our amphetamine-like stimulants. These are methylphenidate and Adderall salts most commonly used. These are not well studied for benefit with MS-related fatigue, but you do occasionally see them prescribed. Side effects can include headache, decreased appetite, insomnia, dry mouth. Should be avoided in some heart conditions or if you have severe uncontrolled blood pressure and certain psychiatric disorders. They are a class 2 controlled substance, so that does mean they have more regulations surrounding their prescription. Next. So I do want to talk about the effectiveness of some of these MS fatigue medications. There have been several studies looking at the effectiveness of amantadine and modafinil for the treatment of MS-related fatigue. And really, these results have been mixed, with some showing that they can have significant improvements in fatigue related to MS, and others showing that they're not necessarily better than placebo. So I did want to briefly go present the results of a recent study called the Triumph MS study. And this was published early in 2021. And what it did was enrolled 136 people with MS who reported having fatigue. And every participant was randomized to one of 4 treatment sequences. And so every participant received each of the 3 medications, amantadine, modafinil, methylphenidate, and placebo for 6 weeks, with a 2-week medication washout period between each treatment cycle. So everyone received every medication at some point in the study, and there was a washout period between each, and every person received placebo for 6 weeks. Fatigue was assessed using an MS fatigue scale at week 5 of each of the treatment courses. Participants were included if they reported having fatigue and they had a fatigue score of 33 or higher, with a range of 0 to 84 and higher numbers being associated with more fatigue. Next. So the results of this study showed that at baseline, our study population had a baseline fatigue score of 51.3. After treatment with each of the medications, fatigue scores decreased to roughly 40 across the board. And so findings from this study showed that there was no significant difference between the study medications and placebo at decreasing or at improving people's MS-related fatigue. Next. There was another secondary analysis that also looked at people who reported higher scores of poor daytime wakefulness or a lot of daytime fatigue. And there was some benefit seen with modafinil and methylphenidate at improving that excessive daytime sleepiness, but it is different than the MS-related fatigue. So these results may seem disappointing at first, but what they really emphasize is that these medications may still have a role in treating somebody's MS-related fatigue, but that often our non-medication options, such as the lifestyle improvements, the cognitive behavioral interventions, exercise interventions, and energy conservation also play a very important role and often have stronger evidence to their ability to improve somebody's MS-related fatigue. Next. And so in summary, hopefully tonight you've seen that treating MS-related fatigue is complex and usually involves a multi-pronged approach that takes both medication and non-medication approaches to really improve your quality of life. Thank you. Next.
Thank you so much, Dr. Hansen. I believe next we're going to hear from Dr. Giang, who is going to update us on some research happenings here at The Ohio State University. She's going to introduce herself, I believe, and let you know all of the exciting new things that we have going on in the research arena here at The Ohio State University.
Thank you, Kristi, and thank you all. I mean, this has been wonderful. It's been really great hearing all the presenters. I am just going to figure out how to upload my slides. All right, so I'm hoping that you can see my slides. There we go. So I'm going to talk about research updates. We do this at every session just to let you know what kind of research is going on here at OSU. We will be covering clinical research that's going on, meaning research that's actually recruiting patients. And we also have lab or bench type research from Dr. Segal's lab. We have a few new faculty that have very interesting research interests as well. So we'll start with a little overview of research in general. Typically it starts from a preclinical level, meaning things start in the lab, things start when we try to investigate mechanisms and processes outside of the clinic, and eventually kind of trickles into the clinic when we start to experiment and see if certain strategies or interventions are helpful to patients, in this case with MS. So we're just going to go through a few of the research opportunities that are available. We'll let you know how you can get involved. So the first one I'm going to talk about is the BTK inhibitor clinical trials. We just started enrollment for these trials not too long ago. Basically, this is a new type of drug that is being investigated for both relapsing and progressive forms of MS. There's a lot of interest, there's a lot of anticipation about whether these drugs are going to be effective because of the unique mechanism of action. Basically, these cells have a direct impact on the immune cells in the brain. And the thought is they may have some kind of neuroprotective effect. And in addition to having an effect on your immune system, they may also have some modulatory effects in the brain. So there's a lot of anticipation. Prior studies in the experimental model of the animal model of MS and in relapsing remitting patients with MS showed really good outcomes. And so at this point, it's in the phase 3 trial where we're looking at these compounds. It's a pill, it's an oral pill that's taken by mouth. For the relapsing remitting MS, it's been compared against teriflunomide, also known as Aubagio. And then for the primary progressive MS, it's been compared against placebo. And so we are actively enrolling for both studies. Talk with your doctor if this is something you are interested in being a part of. We have started enrollment and, we are accepting patients for these studies. If you would like to participate, that's the contact number. These slides are available. You can access them and, give us a call or talk to your doctor. Let them know if this is something that you would like to do. And then I'm going to move towards Dr. Zhang. So Dr. Zhang is one of our new doctors. He just started in the summer, has a very exciting study that he's working on right now. Basically, what he's looking at is how aging affects MS, or how aging and MS kind of interplay with each other. He is going to start recruiting patients sometime in 2022. But this is really, really exciting because we're going to look at the different ways that your biologic age reflects on, genetics and how MS can play into that. And outcomes from these studies are going to give us a lot of ideas on how people with MS age and how the disease progresses over time. So more to come on this later. There will be recruitments that will be done in the future. And then I'm sure a lot of you know about the COVID vaccine study that has been going on for a while. We do have some preliminary data from the initial part of the study. This is being when in the process of publishing the data. And the main question was, how does having MS or being on an MS treatment play into getting the COVID vaccine? Do these have any impact on how patients with MS respond to the vaccine? The next phase of this study is looking at the COVID booster vaccine. As all of us know, the booster vaccines have been out for a while, have been approved for patients that are immune compromised, which includes MS patients and also includes everybody at this point. I have gotten my booster shot. So, if you are interested in doing this booster phase of the study and you have not received your booster yet, let us know. We get a blood sample before you get your booster vaccine, and then we get another sample about 4 weeks after you get that booster vaccine. And we have a very unique neutralizing antibody assay that we are using to measure the antibody levels. So if you want more information, there's the contact, the email, and the phone number, or let your doctor know, send a MyChart message, or just let your doctor know that this is something that you are interested in doing and you'd like to be a part of. And now we're moving towards the lab. So we have a very bustling lab. Dr. Segal, our program director and the chair of neurology, has a very active lab that has done a lot of remarkable work. I just want to showcase some of that work. Very recently, they published a very important paper in one of the big journals about these unique or new cells that were found, new immune cells that were found that may have some kind of neuroprotective role. And there's a lot of research that's going on now to figure out if these cells can help with nerve regeneration. And this is a very unique type of white blood cell that has never been discovered before. This is the first time these are being discovered. And basically we're looking at ways to reverse damage that has been done due to MS. And there's a lot of other studies going on in the lab, one of which is looking at the impact, another study looking at the impact of aging on MS. And then another one looking at biomarkers. What kind of biomarkers can we have to predict how well a patient is doing on a treatment? Also biomarkers to help us understand, progressive MS better, diagnose progressive MS better. So there's a lot of research that's going on, not just in the clinic, but we have a very active lab that's doing a lot of things, that is helping overall our understanding of MS. And then Dr. Harrington also joined us, this summer. She sees patients in clinic and also has research of her own that she's doing. She's looking at a very unique cell type called the oligodendrocyte. This is the cell type that is being damaged in patients that have MS. And so the goals of her research are to look to see how to repair the damage that has happened to these oligodendrocytes, and also to find out how we can cause remyelination, meaning cause those oligodendrocytes to form new myelin and mitigate some of the damage that has been done due to MS. So a lot of very exciting studies that are going on here. And then finally, this is not necessarily research, but this is something we've been working on with, our theater department. We are working on a movement for MS class. This is going to be sort of a dance class for patients with MS. I know the theme at this meeting is talking about fatigue, and we talked about how exercise can help with mitigating, those symptoms of fatigue. So we are working on this movement class. We have a very interesting student that has a lot of interest in this. Her name is Gianna. And if you are interested or you'd want to be contacted when this program starts, her contact information is there. That's an email. And I put the flyer up on the slide. And remember, these slides are available to everyone. At the end, you can access them on our website, and just send us a message. Let us know if you're interested in any of the research that we talked about or any of the programs, including this Movement for MS program that we talked about. That is the end of my presentation. I think I will turn this over to Kristi, and we will get into the Q&A section in a little bit.
Thank you so much, Dr. Yang. That's wonderful. So many exciting things going on. And I would like to add that it's much easier than you think to get involved. I know many of you are getting regular blood draws, and at least for some of our studies, all we need is a blood sample. So if you're interested in participating, perhaps in the biomarker study, you could let your provider know, sign the consent form, and we could grab an extra vial for research during one of your regular blood draws. And I would like to say that Dr. Yang is a wonderful member of our team, and we're so happy to have her. And we're going to move towards Dr. Harrington, and she is going to moderate our question and answer series. And we're so happy to have her here at The Ohio State University. She came to us from Johns Hopkins, and prior to that, she was at UCSF. So we feel very lucky to have her. She's a physician scientist, and you heard about her very wonderful and interesting research that she's doing. So we're definitely benefiting from her presence here. So we're happy to have you tonight, Dr. Harrington, and we look forward to you moderating the question and answer series. And all of our panelists are going to join in, and we're going to attack the questions that you've put out there for us. Thank you so much.
Thank you, Kristi. everybody can turn on their video, we're going to do a lightning panel since we have only about 8 minutes left for questions. We had some really good questions. So Dr. Gang, I'm going to start with you. There was a question about the Regeneron treatment, which you answered also in the Q&A. So I wanted you just to kind of reiterate that for people, your thoughts on that, since you are the COVID antibody expert and vaccine expert, and also would like for your personal opinion about which patients you are prioritizing for these BTK inhibitor studies, and who do you think are the good candidates of your patients that you are posing these to?
Great questions. So I will start with the question about the Regeneron. And for those of you that haven't seen that question, this is a drug that is approved for patients with COVID. The question is asking if it can be used in patients that are immune compromised, like patients that have MS or cancer, to help prevent an infection. And the answer to that question is currently, the Regeneron is approved for patients that have mild MS. So I'm sorry, mild COVID. So basically, if you have COVID and you're not hospitalized, it can be prescribed, and the goal is to prevent the infection from getting severe. You know, it is not approved for patients that are already in the hospital or are already intubated or already have severe COVID. The idea is to give it to patients with mild to moderate COVID to prevent it from getting worse. Now, it is also used off-label meaning, you know, it's not necessarily FDA approved for that reason. If a patient or anybody has been exposed to COVID and they have not been vaccinated, you know, sometimes we could give them this combination. It's an IV infusion to help to prevent that person from getting a COVID infection. At this point, I'm not aware that it's approved for just anyone that is immune compromised or that has a specific diagnosis. There's very specific guidelines about how it is prescribed, and it's for people with COVID that are not hospitalized to prevent severe COVID infection. And then the second question about, you know, who are the best candidates for these studies? So starting with the relapse and remitting study, if you were recently diagnosed or have relapse and remitting MS, let's say you've had a few relapses or new MRI activity within the last couple of years, whether you're on a treatment or not, if you want to be part of this trial, we can look through, you know, your history to see if you will be a qualified candidate. You know, if you've been on a disease-modifying treatment and you've been stable for many years and you've not had a relapse and your MRIs have been stable, you're probably not the candidate we're looking for. We have to document that you've had some kind of a relapse or some kind of new MRI activity recently. And if you're not on a medicine, we put you directly in the trial. If you're already on a medication, there may be a washout period, so to allow that medication to wash out of your system before you go into the trial. And then for patients with primary progressive MS, you know, anyone with primary progressive MS, you have to have a spinal fluid that is positive, meaning a spinal fluid that shows inflammatory markers. You know, we are accepting patients, you know, if you are already on a treatment, which, you know, is ocrelizumab, there's a washout phase. And, you know, we're really excited, especially for primary progressive, because there's not a lot of treatments for that. So I hope that answers both questions.
Great, thank you so much.
Yeah.
All right, Dr. Khan, I have a question for you about screen time for cell phones. Can this add to fatigue, and is there a limit you would recommend? And another question about, some people use you know, screens a lot before bed or in bed. Are there ways that you would say to reduce this, like get off your phone and stop using social media and checking your emails at night?
Sure, so thanks for the question. Definitely we'd recommend a wind down time before bed. So generally like 15 to 20, ideal half an hour, but at least 15 to 20 minutes where you kind of decompress, take a break from social media and from your work emails or anything else that's stressing you out, and try to, whatever you find relaxing for you, to wind down before sleep. Definitely just in terms of screen time in general, really being on a screen actively for, you know, the half hour to an hour before bed, if you can avoid that, that probably will be helpful for your sleep. and definitely avoiding screens during the time that you want to sleep. So if you're struggling with sleep, I don't recommend that you then get on some sort of screen, some sort of electronic device. So if you feel that you have to do something, maybe try listening to like calming music or a boring podcast, or read something on paper that's boring that you're not interested in, but avoiding screens during that bedtime, and probably at least a half hour or so leading up into getting into bed.
Great, thank you so much. Dr. Gillum, we had a question about aquatic therapy. I was wondering if you could address that. Someone said that their provider recommended against it because they had MS, and what are your thoughts about that?
Yeah, that's a great question. At OSU, we have some different temperatured pools depending on different locations. So a lot of our, or just a couple of our facilities have more warm water pools. And so the temperature is usually around 90 degrees, and which would be really warm if you have some symptoms that are exacerbated by being in the warm weather, especially when the humidity is a lot of times worse in there. And that's when it's more likely to cause one of those pseudo exacerbations and just make you really tired. So that's what your physical therapist was probably trying to avoid. We do have a few locations that have more cold water pools. There are facilities that are joined with the YMCAs. And so they have cold water pools that would be in that cooler range, which usually 80 to 85 degrees is what's recommended for patients with MS. So I hope that that's helpful in answering your question.
Great, thank you so much. One really quick question, and then we're going to close out with one question for Kristi if we have time. So Dr. Kelb, I was wondering if you could answer the question about MS and judgment. Do you see people's judgment is sometimes affected with MS?
Yeah, that's a good question. The cognitive concerns that we see in MS can really vary pretty widely, and sometimes it depends on where in the brain we see lesions appear, but typically we don't see too many problems with judgment. More often than not, MS affects these white matter tracts that kind of connect important areas of our brain. So a lot of times what we see is a sort of general cognitive slowing or inefficiency that I'd say is the most common cognitive symptom that we see in MS.
Okay, thank you. And last question will go to Kristi about the 5-hour energy drink and your thoughts about that. And then thank you everybody for being a part of the panel. I think that is our last question. If anything else comes up, we'll submit it on the website and all the materials afterwards.
Okay, well, thank you for that. I do get a lot of questions about 5-hour energy. And what I would say is that any type of energy drink whose main component is caffeine is not going to be advisable. As Dr. Khan mentioned in her speech, it can take up to 10 to 12 hours to eliminate the caffeine that you consume in the morning. And some of these energy drinks can have many, many more times a normal or regular dosing. Some energy drinks do not have caffeine and may have B vitamins or other things like that, but they also contain large amounts of sugar and additives. So they wouldn't fall into the category of no added sugar, no processed food. The best thing to do is really discuss diet and supplements and exercise and sleep with your provider. And I'm always open to chart messages. If there's something you're trying or something you have a question about, please send me that and I'm happy to answer. Again, all of your questions that we didn't get to tonight, they are going to be answered on the website, which is wexnermedical.osu.edu.ms /MS wexnermedical.osu.edu/MS community. All of our events are recorded live, and then you can watch them at your convenience. And if you haven't been to any of our previous events, there are some wonderful already recorded events. So I would like to thank everyone for joining us tonight. And I would like to remind you that we have a lot of wonderful resources here at OSU Wexner Medical Center for our MS patients and our patients with MOG and NMO. So please, if you'd like to, come and visit us at our multidisciplinary clinic, our quality of life clinic, and you can access these through your provider. So we thank you tonight for joining us, and we hope you'll join us in the future for future events that we're going to have. As soon as we come up with our topic for our next event, we'll be letting you know. So look for those questions and those events to be posted. Again, if you would like to schedule an appointment, please go to wexnermedical.osu.edu/appointments, and you can always make a phone call. Call the appointments for the line for appointments is 614-293-4969 or 482-2076. If you're already a patient and you would like to access a specialty clinic, please let your provider know. Send a chart message or mention this at your visit. We also have rehab that you can reach at Martha Morehouse Pavilion, 614-293-4523, and they can direct you to our many sites. So again, thank you everyone for joining us. Thank you for your interest, and thank you for putting up with our minor technical difficulties. At some point, we hope we will see you all in person. Good evening and have a wonderful event. And we are planning our next virtual MS Education event on April 21st, 2022. Hope to see you there. Thank you all and good night.